talk to you about speech delays. I want to go through and really dive into this with you because I know moms and dads that if you are a parent that has a child that is dealing with any type of a speech delay, I know that this is something that you are probably searching for solutions. It's frustrating, and you're looking to do everything you can to help your child to have their best quality of life. So, in this video, what we're going to dive into is helping you to understand the difference between a functional speech delay and an anatomical speech delay caused by a change in the anatomy and neurology that prevents the brain's ability from receiving the message correctly. And because there's a functional cause and there's an anatomical cause. And once we differentiate those, and if you've already done that testing, this may help, but we're going to give you some better insights perhaps to have an understanding of what you can do if your child has a functional speech delay. So let's talk first and foremost about what is going on. So if we talk about this in terms of the genetic anatomical components versus functional, then we have to realize that when a child has a speech delay and there's no anatomical changes, it's not just a bad deck of cards. There can be a number of different things that are happening to your child's central and autonomic nervous system that is being affected in a number of different ways. And one of the biggest ways is it's going to affect their ability to properly process what's coming in from the sensory environment, and it alters everything that comes out afterwards. So let's walk through this. So if we understand the concept that input equals output, it has to go in this cascade as you see on the screen. Sensory input has to be received by the brain. The brain has to be able to properly receive and interpret the sensory information. It has to be sent to the receptive and expressive areas of the brain called the Broca's and Wernicke's areas, and that results then in time with speech output being formed and created. And if the way the brain is perceiving the information is accurate, then around a year, we start to see that there is constructive speech and it starts to build. And what starts happening is that the brain begins to wire more and more and more of these pathways together. So then we start getting one word, then two words, then combinations of words and phrases, then we get sentences, then we get paragraphs, and we start having all of these things that layer one upon the other. But it all starts with proper input to the brain coming in through the sensory system. This is where things can go off of the rails. And this is where most people have never heard this type of information about what is happening with their child, because this is what we have found is in the vast majority of cases, when there is a functional issue, this is where it starts. And so let's talk about what this means. So if you think about this from just a straight input-output perspective, if the brain is not getting the right type of sensory input, then all you're going to essentially get is altered background information, somewhat akin to static. And so you have to start asking yourself, well, what is interfering with the brain getting messages? What can disrupt this? Well, essentially what ends up happening is that if altered sensory processing leads to altered output from the body, then this is going to be a point where if we figure out what is causing this, then we can start to do something about changing it. Because if input equals output, and we know there's something that's interfering with this, then we can start looking at how do we change the way the brain is receiving sensory information. But it starts with understanding what are our likely starting points, and let's dive into those. So the most common correlation that we see in our practice are intervention-based deliveries are a huge common factor among children that we take care of with speech delays. So let's take a look at it like this. If you think about things like a birth process, most people don't really understand what happens during a birth process or the neurological impact. But there is very clear research and mountains of evidence that are really documenting heavily the impact that birth process has on neurological development. So think of it like this. When a child is delivered in just a standard vaginal delivery, no assistance, just a normal delivery, the amount of traction forces that is applied by the OB, the midwife, is going to range somewhere between 20 to 20 or so pounds. And it's axial traction, right? Pulling on the base of the skull, lateral bending, side to side bending, and then rotational forces to help to clear the shoulders, clear the abdomen, pull the feet. Because the neck is the only point typically that's used for a lever. And so that right there is a place where if there's a traction force, that can create some mild trauma to the upper cervical spine, which is loaded with receptors that help the brain to properly interpret and receive information from the world. Now, the more you step into interventions, the bigger the force, the bigger the stress becomes. And there's all different manner of different types of stressors that can happen. So let's say, for example, the baby's in a breech position. The breech position is going to compromise spine mechanics, which will alter neuromechanics, which alters sensory processing and perception, because the brain is not going to be in a position to get all of the right messaging because things are altered. That torque, the positional stress on the body, alters this sense called proprioception. Proprioception is this really interesting effect on the brain. It organizes sensory input, it calms the brain by activating the parasympathetic nervous system via the vagus nerve, and in the cases of pain, it dampens pain. Now, conversely, if a vertebra doesn't move, a process that we call a subluxation, right? It's this process of misaligning and getting stuck. That alteration in input then now has a very specific effect. It alters sensory processing. It activates the sympathetic fight or flight nervous system, and in time, it can produce pain, and very much in that order. So, if you have a complicated labor and delivery, like there's a positional issue, or we have to have bigger interventions like Pitocin, or like a cesarean section where there's more force applied, every single time that you add in a layer, a stressor to the child's neurospinal system, then those effects can affect vagal tone. Because let's take, for example, in a C-section. In a cesarean section, there is a lot of traction force. The minimum number is around 40 pounds of axial traction and can escalate significantly based upon the difficulty of the delivery. And so the more complicated it gets, the more force that's applied. You can get those numbers into 60, 80. If they throw in a vacuum extractor, those numbers can even exceed as high as 100 pounds of force on a newborn's undeveloped neurospinal system. And so think about it like this. If you have a newborn, okay, and you take the baby, if you were to grab them by the base of their skull at a 40, 60, 80-pound weight and then go back and forth like this is essentially the same amount of force that a baby is receiving at the time of birth when there are these more complicated labors and delivery. So I think it doesn't take a big stretch to realize there's a very good likelihood that there would be some degree of trauma to a baby's neck as a result of this. That's why so many times we find that newborns have these early signs that are considered to be soft signs. Things like torticollis, heads bent like this, loss of range of motion, which leads to difficulty feeding, latching. It can make them very colicky. And there's a lot of things that can make them colicky without a torticollis. But the stress of those birth processes can make them very irritable, very colicky, poor sleeping. They require tons of movement and proprioceptive input before they can calm down and go to sleep. It can make them very bad sleepers. It can alter things like digestion because vagal tone is altered in all of these things. And vagus, guess what? Regulates every function of healing and calming and soothing. So digestive process. So we could see increase in spit up. We could see problems with constipation. We could see poor sleep. And all these things will snowball as time progresses. But know that if that's present, there is also altered sensory processing occurring at the exact same time. Let's put it in a context that we as moms and dads can understand. If you get headaches, and I know all of us at some point in time probably have had a headache. If you get a headache, we know that most headaches are driven by the upper cervical spine. And when you get a headache, the very first thing that most people notice is the loss of range of motion. Your neck gets stiff. But then you start to notice that there is this ramp up in your senses. Sights are getting brighter, sounds are getting louder, everything starts to feel amplified. So there's all these changes that happen within your sensory system, and then pain can come. But it's this cascade of things as it goes over the edge. Sometimes that headache can even lead to you having issues like nausea, vomiting, or dizziness. So then let me pose a question to you. If you get nauseous when you get a headache, is that a stomach problem or a nerve to the stomach problem? If your answer is nerve to the stomach, you're correct. Your vagus nerve, which controls your stomach and your intestines and all of these things, is being affected by this alteration in input that is causing the nervous system to be in a constant ongoing state of fight or flight and is lowering the activity of the vagus nerve so it does not function nearly as well. These impacts, though, lead up in other events, right? What they do is they create things like they alter the brain's ability to develop on track, which is why you see a lot of kids who have these kind of like heavy interventions. There's also a lot of other diagnoses you tend to see, things like diagnoses of sensory processing or autism or ADHD, because based upon where a child's starting point is, the stressors they're exposed to, their brain is going to go down different amount of developmental paths based upon the severity of the stressors and other things like, the different types of stressors they had early in life, mom was exposed to, chemical exposures, foods, all of these things can accumulate the stressors that a baby's nervous system goes through that can drive them down different pathways neurologically. But what we know is that the bigger the intervention, the bigger the pattern of interference between the brain and the body, the greater the likelihood there is going to be some defect, some deficit. So the brain is going to have an altered ability to perceive the world. Some kids, it becomes straight sensory processing issues. But in many kids, it is also a speech delay because now the brain is not getting the correct input. So now speech is going to be affected. And it's going to take a lot more work to try and smooth out those pathways. And without doing something to change the input, it could be a much more difficult process. If you're thinking about this and you're saying, well, what kind of research data is on this? Well, let me just give you one piece. There's a great research study that was done by Dr. Sam Wang, who's a researcher out of Princeton. And he did a study on cesarean sections in particular. And he was trying to see if there were connections and correlations between autism in twins and birth process. And he had a great quote in this study. It said, and I quote, "The correlation between cesarean section and the later onset of autism was greater than the correlation between cigarette smoking and lung cancer." Let that sit in for a second. Greater than the correlation between cigarette smoking and lung cancer. The data is pretty compelling when you start diving into these research studies. This is why I wanted to present this to you. So, and I don't say this to scare you, but I think it's important that we as parents understand that these things have consequences. There are impacts. And if we don't do something to address these things early, they compound over time. Because the nervous system is really interesting in the way that it works. The nervous system has this thing called neuroplasticity, which is always a part of the equation. This is why the way that you unlock the brain, the way that you begin to change things, is the earlier that you can correct the sensory input, the better the chance that you have of really unlocking the brain completely. The longer the brain goes down these pathways, the more some of these pathways at a certain point in time become somewhat hardwired in, as you see with a lot of kids that are on the spectrum. So the earlier that we can intervene, the faster the pace of change we're going to see. So let's look at this from the perspective of when we as pediatric chiropractors get into the equation, our very first job is to figure out exactly what is interfering with the messages being received by the brain. What is altering the sensory processing? And these subluxations that I talked about earlier are literally interferences. They are alterations in sensory processing that activate the sympathetic nervous system and inhibit vagal tone, and they affect the developmental tract of the brain, and they inhibit the brain's ability to properly receive and coordinate all of the information coming in. And so there's all these different expressions. But the more data we get early, the faster that we can start getting into the equation, the faster we can start to unlock the brain, helping a child to achieve their optimum potential. That's why it's such a big deal to start getting children adjusted so early, because guess what happens when you adjust the neurospinal system of a child? You activate the vagus, you correct sensory processing, and the brain starts this process of moving forward, and it starts to advance development, and it starts to refire and rewire connections. So this becomes a big deal from the help standpoint, because now what you can do is you have this really interesting way that you can start to drive a child's brain back into growth and development mode and help to organize what's coming in. And it unlocks this really critical thing like we talked about, neuroplasticity. Because the great thing about neuroplasticity is the brain is always changeable throughout your life. So even if your child has been going through these challenges for a long time, it's not the end of the story. That's what you see, right? You go and do everything you can to try and help your child. And when you start doing things like pediatric chiropractic and you combine it with your speech therapy and your OT, what it allows us to do, and you think about this in a hierarchy, when we get into the equation, we unlock the sensory system for your therapist. It literally allows the child's brain to be receptive to what they're doing, and then it accelerates the pace at which the brain is able to begin to play catch up. Because the refiring and rewiring the process requires that you get rid of the sensory processing problem, which is these underlying background noise, alterations in sensory processing. We call them subluxations. And then you drive normal input up, which is what the adjustments do. And then you drive the frontal lobe and you drive the Broca's and Wernicke's areas and you drive organization within the brain, helping these areas to begin to feed forward. all of these correcting of processes. And this becomes a big deal because now you can keep the brain in the state of changeability by understanding what is coming in, and then you quickly get some information about where the brain is in terms of the big stress points, and then you create a plan that allows you to reintroduce normal sensory input through adjustments, and you help to drive the brain to change, and you begin to change rapidly. This is where we start really looking at things like, how do we get a child on track? What is our main goal? Like, how do we do this? Now, I know at this point, a lot of you probably have questions. So I know we've talked a lot about this. We want to give you some resources to start looking at this, to start doing homework for yourself. So first things first, check out our website. Go to elitefamilychiros.com. If you specifically want to talk to one of our doctors about your child, just call the number on the screen, 440-230-2300. I would also encourage you to go to another website, which is pxdocs.com, to begin doing your own homework. There's lots of great literature, science, research articles on there that you can utilize to help to give you a lot of this information that I know most of us are searching for as parents, to help to give you certainty about what your next step should be. So do that. Take a look at that information. Look at the parent testimonials. There's lots of parents out there that have shared their stories, what's happened with their children. Because obviously the most important thing that matters ultimately is results. And so when you see on there that all of these parents that have given this information have shared their stories, it's because they came in with a similar challenge to you, and they saw tremendous benefits by getting the information, getting these insight neuroscans, and getting the data. Because that's the most important thing at this point. We need to get the insight neuroscans for your child, because once we take their history information and we get the insight neuroscans, it gives us a 360-degree view of what is coming into their central nervous system, their brain, and their autonomics, and then what is coming out. And so we can go into the depth of the nuances, but I don't want to bore you with all this. I want to get you to understand that this is the next major step that needs to be accomplished. Once we get scan data, then what we can do is we can take that information, construct a useful care plan, and then make decisions about how often do we need to adjust them? How long do they need to be in a care plan for? What are the things that we need to combine together to help your child to get the best results possible? And then we have a tracking tool. Because once we start applying care, we need to be able to track to make sure the brain is responding. And so this allows us to do both parts: an assessment tool for baselines of where the brain is, and then an ongoing tracking tool for change. And so as we use these things together, it helps us to make sure that we're never guessing about what's happening with your child. We have this 360-degree view that allows us to make sure that all the decisions that we make clinically are the ones that your child's brain needs to keep advancing forward. Because ultimately, moms and dads, everything that we do here is about making sure that we help your children to unlock their superpowers, to live their best quality of life, because the most important thing that we can do for any child is to help them to be able to achieve the best quality of life possible, to live their best life without limitations, and to literally remove any barrier that stands in front of our kids living their best life. So guys, I hope this is super helpful. If you have questions, again, go and visit us at elitefamilychiros.com. Again, go to pxdocs.com. Or if you want to call and ask questions, you can go to 440-230-2300. Give us a call, and we can set up the time to talk about your child, your questions, your concerns, and see what we can do to help you, to help your child to live their best quality of life. So I thank you so much for your time today. And I would encourage you to just let us know how we can help and answer any questions you have. Okay. God bless you.